Hello everyone. This presentation is on mulisan, also called oyster shell powder. It is on the California Acupuncture Board herbal formula list. I will briefly review the traditional pattern, a hypothetical patient, 3 possible drug-herb interactions, and a practical management plan. The goal is to connect traditional Chinese herbology with modern medication safety in clear student language. Traditionally, mulisan belongs to the category stabilize and bind. A representative pattern is spontaneous sweating or night sweating due to deficiency. Important ingredients include mulai, huang kai, fuzio mai, ma huang jian. In practice, the formula should be chosen by matching the full pattern, not simply by matching a biomedical diagnosis. I would also screen for red flags, confirm that urgent medical care is not being delayed, and review all medications, supplements, and over-the-counter products before recommending treatment. My hypothetical patient is 56-year-old woman with bothersome night sweating and fatigue. The current medicines are levothyroxine, tacrolimus, metformin. This case gives a possible reason to consider mulisan, but it also creates interaction questions. I would document tongue and pulse findings that support the pattern, confirm the diagnosis, and ask about kidney or liver disease, bleeding history, pregnancy status when relevant, and prior reactions to herbs or supplements. Medication reconciliation is essential because many clinically important interactions come from the combined physiologic effect of herbs and pharmaceuticals. Interaction 1 is mulai plus levothyroxine. The mechanism is that mineral-rich oyster shell can reduce absorption of levothyroxine. The clinical significance is clinically relevant. My management plan is separate the two by several hours. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. Interaction 2 is huang kai plus tacrolimus. The mechanism is that astragalus may be undesirable in immunosuppressed patients because of immunomodulating effects. The clinical significance is uncertain but important. My management plan is use only with specialist approval. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. Interaction 3 is huang kai plus metformin. The mechanism is that astragalus may modestly improve glucose control. The clinical significance is usually low to moderate. My management plan is monitor glucose and overall symptom response. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. In conclusion, mulisan may be reasonable when the patient truly matches the pattern spontaneous sweating or night sweating due to deficiency. The safety question is not whether herbs are simply safe or unsafe. Risk depends on the specific ingredients, the product quality, the dose, the treatment duration, the patient's organ function, and the medicines being taken. I would start conservatively, monitor the most relevant objective values, and communicate with the patient's physician and pharmacist. This presentation is educational and does not replace individualized medical care. Thank you.